Okay, so the first thing I want to do is introduce myself. My name is Carla Spinelli. I started this journey with CCL Injury years ago. My dog was then 3 years old. He tore his CCL chasing a skunk, which he killed. It reeked. He got another skunk this year. He got skunked. He didn't kill that one though. But yeah, it was really such a stressful time because I just didn't know what to do. I was searching online, trying to find all these answers and the right website or the right video, and I just couldn't find anything. So I said, why does it have to be like this? I don't believe that it has to be so stressful. So that's when I decided to write my book. So I started taking, you guys know this book. It is available on Amazon if you're at the stage where you feel like it could benefit you. I wanted to write a book because I didn't want other people to have to go through what I was going through. I think that if you start out right, it doesn't have to be super stressful. And that's why I think doing some Facebook Live events like this is going to be helpful for you guys, because I want to take the stress and the confusion out of the picture and replace it with preparation and confidence, because that makes everything so much easier. So I'm going to just look at the chats here for a sec. Marsha's here. Hey, Marsha. Okay, so what I want you guys to do is to just go ahead and you can put a comment in. If you've got a question, go ahead and ask it now. And then in between your asking, I'm going to I've got a list of questions and I'm just going to kind of like fill in the gap. So go ahead and put your questions in as a comment. And I think somewhere along the way, and I don't know if it can happen with it has to happen on a replay or if it can happen here in a live, but I know when I watch Facebook Lives, there's like the little bar at the bottom that has like the thumbs up emoji and the heart and the laughing thing, the emoji. You can click on those and send those up. It might be a replay feature though, so I don't know. Oh, Liz is from the UK. It's so cool. One of the things that I think I love the most about these Facebook forums is that I get to talk to people from all over the world. It's so neat. So thank you so much for being here, Liz. Liz, tell me your dog's name. Just refresh me, or tell me what your dog looks like, because I might remember. All right, so let's start. So first thing I want to talk about is the other CCL. Now I've got a long list of stuff here, so just keep going and putting your comments in, and I'll get to answering your questions. But I'll just start with my list. So the other CCL, this is a major issue that people have, because I think we're all trying to preserve the opposite leg, and it depends on how long your dog has been limping on the original side to say then what's going to happen with the uninjured CCL. The longer your dog limps, the higher the likelihood is that the other CCL is going to start to degrade. And usually these CCL tears, they happen slowly and over time. So if your dog has just started limping, you have a really tough task, and that is that you have to try to control your dog's jumping, running, zoomies, inside the house and outside the house too. And if you do that, you're going to preserve the opposite CCL. When my dog first hurt his CCL, I would have these moments where I would feel so sorry for him, because the guilt kicks in. It would be a day where maybe he rested a couple days before, the meds were working, he was on an anti-inflammatory, everything was working well. And then what would happen? I'd feel sorry for him, I would give in, and I'd let him run around the yard. So stupid. It was a huge mistake I made. So if you're at the beginning stages and your dog has just been diagnosed, if you want to preserve what's left of the other CCL, it's called the contralateral, meaning the other side CCL, then you've got to control all the movements that load up the knee with extra pressure, and that is jumping, pulling, zoomies, even jumping on and off the couch. being still and then going to take off running. These are all things that just really load up the joint, the knee joint, with biomechanical forces that then can aggravate or further injure the contralateral CCL. I'm going to look at the chats because I see some stuff popping up here. All right. Elsa has meds but still cries. So, oh, Lynette, Lynette's dog just came home from surgery, and you're on day 2. And I remember how that is. And it's going to take you guys, if you're new and you're just in the early stages of recovery, it's going to take you some time to kind of figure out when to time the medication. And you might have to like alter it a little bit. You might need some help from the surgeon about like strategically dosing, so that maybe one of the last dosages they get is like right before bed, half hour or so before bed, so that the medication is doing its job when you need it most. Now, during the day, we want good pain control. And sometimes it's just tough. There's a lot of, I don't know, the data suggests that certain pain meds aren't as effective as others. My dog took tramadol, and there is some evidence that says it's not the best one. So if you feel like your dog's pain control isn't good, have a conversation with the vet. Now let's talk about that a little bit, because I remember with my dog's first TPLO, I was so nervous to call the surgeon because I didn't want to be known as like the helicopter pest mom, pain in the neck. Oh, there she is again calling. And so what would I do? I'd go online and I'd search for answers and stuff like that, when really all I should have done was just call the vet. Call the surgeon, talk to a veterinary nurse, talk to one of the vet techs. But I wondered, don't worry about it. You paid a lot of money for surgery, and part of it is the aftercare. So just put a call into the vet if you feel like pain control isn't good. I think that with our post-op dogs, especially when they just come home, they don't understand what's going on. And I think that if we're there with them, just consoling them, if you can get into their recovery area, obviously if they have a crate, chances are not good that you're going to fit in there with them. But certainly if you have a little recovery area set up that you can go into with them and just soothe them and just love them up a little bit, I think that goes a long way. And I know some people do their recovery areas in parts of the house where they are not sitting. I don't love that. And I don't love it because I think about our dogs like I would think about a little kid. And what do little kids want when they don't feel well? They want their mommy, right? So I'm all for hanging out with the dog, especially during that first crucial week of recovery. So you're there to console them. How long does it take for the bone to look healed on x-ray? We had 8 weeks x-rays last week, but I can still see a gap between the bones. Yeah, that's a great question. You know, some surgeons do the x-rays, the post-op x-rays or follow-up x-rays at 6 weeks. And usually those people are the ones who say, my dog's not fully healed yet. And 8 weeks they're still usually not fully healed, but every dog's different. And they're different because their underlying medical conditions are playing a role in how quickly they heal, their age, stuff like that. And also which procedure they had. So we could talk about something that's less invasive, like lateral suture, and they're not cutting into bone, and so they heal fast. But then when we look at a bone cutting procedure like TPLO, TTA, CBLO, MMP, all those, it takes longer because they're cutting the bone. And so some dogs are slow to heal. Like I know, I want to say Megan Ann, you might know her from a different CCL recovery group. She's also in this group. She's the one with the beginner's guide, and Haley Jane, she's the cutest little thing. I think Megan said that her dog wasn't fully fused until like 10 weeks. So it just takes time, and bone is always remodeling, even after it's healed, you know, and it happens like that in humans too. So you just have to be patient, and you want to minimize the added stress on a bone that is healing, even though I guess the repair itself is really stable because it's all held together by metal and, you know, a plate and screws. There's still a fragile component to it. So just hang in there. The bone will heal. Looking over here. Nicole. I remember you, Nicole. So glad. I'm so happy that that my book helped you. That's awesome. Thank you. Okay, Chris, I'm wondering if surgery is the best option, if I should try other things first. You're asking great stuff. So, okay. I think it depends on a lot of factors. I don't think there's anything wrong with doing a little conservative management. So you'll read online. It's also called CM, just for short. Conservative management is basically anything besides surgery. So what does that mean? It could be supplements, prescription medications, physical therapy, acupuncture, chiropractic, massage, cold laser. What else? What am I missing? Stuff like that, non-surgical. A stifle brace would be another example. And so could you try those things first before moving into surgery? Sure, you could, but it also depends on your dog's ability to get around. So I'm going to use my dog as an example. I did conservative management because the more I read about these surgeries, the more scared I got. I got freaked out. And it so happens that the surgery that I ended up choosing, TPLO, was the one that I said, if I do anything, I will not do this TPLO. It looks so scary and so awful. But then I did end up choosing it for both of his surgeries. But conservative management first, I think there's no harm in it. You know, these CCL surgeries are elective, means we're choosing to have them done. Some people go through and they do conservative management and their dogs heal just fine, but not all do. And when Vinny hurt his knee, he was limping quite a bit. I got him a stifle brace, and I have that right here because I want to show it to you. But he then started to limp on the opposite side. So it's like when you do conservative management, there's a window of time where you have to say, okay, I'm going to give it this amount of time. And if I don't see some really good results, like measurable results, reduction in lameness, and I'm talking about the severity, how much that dog's holding his or her leg up, their mobility, just getting around, doing normal stuff, getting up from sitting down or lying down to standing, even just to take little potty breaks and stuff. Some dogs are really so limited. Some dogs can hardly walk, right? They're scooching around. They have 2 torn CCLs and they're using their front legs and scooching their butt. For a dog like that, would I try conservative management? No, I wouldn't. I feel like their mobility is so hindered. They need something more, and surgery really is the best option for a dog like that. But conservative management, sure, I would say try it for like a month, maybe like 6 weeks max, because don't forget that for every week that passes where they're limping, it means you've got now another week of muscle atrophy or muscle weakness that's going to start up, but you also have now weeks and weeks more of stress on the other CCL. So that's kind of the game we're playing here. We don't want to rush to surgery, but we also need to be mindful of the opposite CCL, because the studies show that 50 to 70% of dogs tear the opposite CCL. So it's kind of like the game we play with deciding when surgery is right. Oh, Artie, yeah. That little terrier, he's so cute. Yeah. The caudal cruciate, Liz, he damaged that one, or the cranial cruciate. The cranial cruciate is the anterior cruciate. The one in front, that's the one most dogs tear. Crystal, what precautions can be taken once your dog has been given the clear after their 8-week x-ray? And do you have any recommendations on how to reintroduce your dog to normal activity? That's a good one. That is so important, because people go and they get their 8-week x-rays. It's what we've all been waiting for, right? And then the doctor says, green light, go for it. and you bring your dog home and you can't wait to not have the leash attached, and you let them go and they're running around, and then what happens later that night? They're limping. It doesn't necessarily mean that you did something to the implant or the screws, but those muscles around the joint are still so weak. And so it takes time for muscles to get strong again. Muscle atrophy, if you've ever seen a person who has been in a cast, whether it's a leg cast or a broken arm, the muscles get super scrawny. That's muscle atrophy. If you don't use the muscle, they just kind of become super weak and they look scrawny. And that's what's happening to our dog's leg, especially if they've been limping for a while and they're not using the leg. And then we go and ask them to run on it when the muscles are still weak. It's not good. They're going to limp. So slow reintroduction. That means even if the doctor gives you the green light, you are wise to continue to work on a leash. And also, if you're going to let them run, that you are doing like little controlled jogs. And I mean short duration, and then see how they do. Look for the very subtle signs that your dog is giving you, that they're in pain when you're starting to resume activity, okay? So I want to go back because my brain's like, thinking of too many things here. But when you're reintroducing activity, you want to make the situation be optimal. So what that means is don't walk them on a path that's uphill with tree trunks and branches and ruts and stuff like that. Choose a level path. If you're going to be walking somewhere for the first time, you might not want to go to a dog park where lots of other dogs are. That's another thing where our pups get into trouble because they're vulnerable and other dogs can come up. And so you want this dog to be able to resume activity without having to pull, jump, or go over difficult terrain. Regarding the recommendations about reintroducing, that's something where a canine physiotherapist can really help you because they've got more of a timeline. It's just like when we go to PT, they've got a timeline. You should be able to do this, and when you can do this thing, then you move to the next one. So it's slow introduction, Crystal, and then looking for those signs of pain. And then if you see pain signals, then you have to go less for the next couple of days, and you just are kind of so intricate. You're just kind of working with them that way. I don't want to go off into a tangent here, but Crystal, it was such a good question. So let me just explain here. I'm a chiropractor, and here's what I tell my patients, okay? So somebody might say, I have sciatica. It feels like my leg is being electrocuted. I can't walk. I can't move, but I want to get outside. I'll say, okay. Let's say they tell me, I usually walk for an hour, or I usually walk for a mile. I'll say, you can still walk for a mile. Oh, no, I can't because my leg's killing me. Yes, you can, but here's how you're going to do it. You're going to do it smartly. And so what you have to do is you go out and you walk, and then you are always watching the clock to see when the first symptom appears. It could be tingling in your leg. It could be butt pain. It could be back pain. For your dog, it could be, you see them doing that they have like a little hitch in their giddy up. They're picking up their leg a little bit. They stop and sit down. They're looking at you. They lick their leg. Those are pain signs. So if you see those things, you note, what time did that happen? Let's say it happens at minute 7. Now that's going to be the threshold for your next walk. You walk for 6 or 7 minutes, and you do multiple walks like that. So long as they have an easy time that night and that day, then you can go 5 minutes more the next couple of days. Okay, in 2 days, you do 5 minutes more. See how they do. Look for signs of pain. And that's how you slowly reintroduce activity. It's always by watching. You have to be like a detective, okay? Okay. He keeps jumping on the bed. Is this imperative that he not do this prior to surgery? Yes, with a capital Y, no jumping. I know it's hard. Close the bedroom doors, put up a baby gate. The more he jumps, the more he will load up that injured knee. And actually, when he's jumping up and down off the bed, he's actually really relying more on the good leg. What does that do? It wears out the good CCL. And that's why our dogs, that's one of the reasons why our dogs usually tear both sides. So yeah, you want to minimize jumping anywhere, running anywhere, pre-op, okay? Melinda, Clara is 9 years old. Is there a danger with the anesthesia? You know, this is an important one. When I wrote my book, I had a board certified surgeon fact check it. And I said, what did I miss here? Is there anything you can see that that I should be putting in this book? And she said, yeah, I think one thing you need to put in is that older dogs can still have these surgeries. And so when we think about anesthesia and kidney health and all that stuff and the risk, the doctor should know whether or not the anesthesia is going to be risky for your dog. And sometimes it's breed related and sometimes it's age related, but lots of doctors will say that a good anesthesiologist, a good surgeon will know the right way to care for an older dog going through surgery. So should not be an issue. 9 years old, there are dogs that have had CCL surgery much older than 9. Now, if your dog has an underlying medical condition, this is where I feel like a board certified doctor is really important. I will talk about my rant. I'm not going to miss out on this because this is something that if you see me in these CCL groups, I'm always like putting on the website www.acvs.org. That's how you find a board certified surgeon. And I'll go on that rant in a while. Hey, Cheryl. All right, Lori, are they in pain while waiting for surgery? I'm glad you asked this one. I'm going to keep reading. I don't like the effects the painkillers have, so I don't give it all the time. And you've been using arnica twice a day. Is that strong enough? Lori, you sound like I sounded. All right, so are they in pain while they're waiting for surgery? Yes. One of the things, it's so interesting because I was in, I don't remember if it was my group or another CCL related group, but somebody said, my dog's not in pain, but they are limping a little bit. And if your dog is limping, they're in pain. When they put their paw to the ground and they feel pain, that's what's making them retract their leg up and not want to put weight on it. So if your dog is limping, if there's instability in the knee joint that makes them kind of skip some steps, they're doing it because they're in pain. So yes, while our dogs are waiting for surgery, they are in pain. Now, pain medications, as a chiropractor, you know, I try to do all this natural stuff, right? So when my dog was doing well, he was taking, I think, Deramax at the time. They switched him to Rimadyl, but when he was taking that, you know, I research too much. And so I read the side effects and I was like, oh, maybe I shouldn't give it to him. But you know what was happening? He was doing better because he was on the medication. And what did I do? I would sometimes give it and sometimes not. And then what happened? He limped more. And when he's limping more, that means he's having to rely on the other side more. It wears out the other CCL. And do you see how it's like this cyclical thing? The idea is that we want to stay ahead of the pain. If you've ever had migraine headaches or know someone who's had a migraine headache, the idea is that you want to control the pain. You want to stay ahead of the pain. If you've ever had a surgery and you have pain medications and you let the pain get up to an 8 out of 10 severity before you take your medications, it's real hard to get it to go down to a normal amount. Well, the same thing happens with our dogs. We want to stay ahead of the pain and keep the symptoms manageable so the dog can do their normal thing, go outside to pee or poop, take a little bit of a walk without limping and really struggling. Arnica, you know, I like arnica. However, can I say whether it's strong enough? I can't. I don't know enough about it for dogs, so I can't answer that one. Okay. As Swivel lock, Heidi. Logan had the swivel lock procedure done on his left leg. Are you familiar? I'm really not familiar with that. I need to learn more about that. I don't even have it in my book. Heidi, what state do you live in? Are you in the States or are you abroad? Because that might make a difference. I will learn more about that. He had TPLO 6 years ago on the right, and it's healed and is good and strong. So my curiosity then, Heidi, is if he had TPLO with good results, what made you choose the other, a different procedure? Curious about that. Oh, he did damage. So now, Liz, I'm reading your answer that he did damage the posterior cruciate ligament. It's the one that lies behind. No, it's not going to change. When you're doing his recovery, you still want to do all the same precautions with just as you would with a cranial cruciate ligament tear. It's all the same stuff that's going to aggravate the knee. You want to just minimize that stuff. At what point can dogs start things like physio? You can start it right away. It's just that what you start with is not, indicative of how they'll do a stepwise kind of, they'll get a little bit more aggressive, or I'll use the word assertive with the physical therapy. They'll do more difficult things, or you will do more difficult things as he progresses. But so you'll start with real basic stuff like passive range of motion or PROM, icing and heating. Those are types of physical therapy types of modalities, passive stretches, massage, stuff like that. That's how you start. And then slow, controlled leash walks. Heidi talks about that dog. She's read that dogs shouldn't run for 6 months post-surgery. I was not given that instruction. I would let them do like little mini jogs in the yard with a leash, straight line, nothing crazy. No, even though the doctor said, you've got the green light, he's fully healed, he's fused. I still didn't let him run, and certainly didn't play fetch. Fetch has been, it does not work for my dog. He really limps a lot after. But I will say this, Heidi, after surgery, 6 months, they're pretty sound, as long as they didn't start out with a ton of atrophy and you did some good PT. They should be able to do a little bit of short duration jogging. But again, I'm not a vet, and I'm not a canine PT. I would love to be a canine PT, but that would be a really good question to discuss with a surgeon. You're in Canada. I love Canada. I'm from upstate New York, Rochester, New York. So I know Canada's huge, but we would go to Toronto a lot. And I know I'm not saying that right. Toronto, that's how the Canadians say it. All right. Oh, I love this question. Clara's surgery is 4 weeks off. Would the soft orthocanus braces on both legs help to protect the other knee? This is good. All right. I don't like that brace. I don't like any brace that is not custom fitted. Why? They slip, they slide down, they twist. What does that mean? It means the dog's biomechanics of their knee joint, the normal movement of their knee, it can't do it because this thing it's impeding normal movement of the knee. Their knee isn't moving normally anyway because everything is shifting because of the tear. But I'm not a fan of non-custom braces. This is a nice little segue into showing you Vinny's brace. It's very, very cute. All right, so I'm going to have to look here. This is Vinny's knee brace. When I was doing conservative management and so afraid of surgery, I thought, all right, I'm gonna do it. I'm gonna get this brace. I got it from My Pet's Brace, which is in Morgantown, Pennsylvania, and so this is it. And bends, nice and flexible. These little straps, he could bite these straps off in minutes. He would just silently nibble, and he would be great while I was watching him. And then the second I walked away, like, you know, you go to the bathroom for a second, he'd have the brace off. So then I would have to call the company and request new straps, and they would come by snail mail. That meant he couldn't wear his brace, and it didn't work. My brace didn't work. $900. Boom. And quite honestly, so he would nibble the straps off, and then I would get new ones. He did this maybe three times. Makes me sound like a terrible dog mom. I'm pretty good at helicoptering, but I guess I wasn't as good as I thought. So he didn't wear it long enough. And when you get a brace, you have to have them wear it for at least 9 months, even more, really. And the idea is that in wearing the brace, you're stopping the faulty movement that just keeps shearing the two bones against each other. I'm laughing because I'm going to use my hands to talk. I need to buy a model bone of a dog knee so that I don't have to do this. But all right, the tibia is the shin bone. The femur is the thigh bone. The job of the cruciate ligament is to prevent the anterior thrusting or shearing of the tibia relative to the femur. The ligament starts here on the femur and then attaches to the tibia. As that dog jumps, what happens is the bone slips forward and then the surfaces rub. It causes inflammation and pain and swelling and all that stuff. So when they have a brace on, what's happening is it's controlling the movement so that you don't have this. Theoretically, as the dog's knee mobility is controlled by the brace, internally, scar tissue can form that acts like an internal stabilizer. Now, scar tissue is kind of sucky. It's not great. It is not supple like normal tissue is. It can easily, just as it forms, it even more easily breaks down. So when you're going to if you're going to choose a stifle brace, it's a time commitment, and you have to be diligent with it. You can't have the brace on one day and then go, oh, maybe it's bothering him, and I'll let him just run without it or walk without it. Don't waste your money if you're going to do that. Brands of stifle braces. My pet's brace, he was limping more when he would have these on and off bouts with wearing this brace. I called the company, and it seemed to me like they had my money, and when I needed them to talk to me about why is my dog limping more, they didn't call me back. I don't like that. Once you have my money, I have an expectation. I want to have a continued relationship. I'm not going to call a million times and drive people crazy, but I had a legitimate question that just never got answered. So it didn't matter because he started limping on the other CCL, and he was having such a hard time walking that I knew I had to go forward with surgery. So the brace was kind of like, I guess it's not going to help anyway. So I just gave up. Regarding brace companies, I can give a couple plugs here. I was just thinking, if I was going to buy another brace, would I buy it from My Pet's Brace? Maybe because I could drive there, but I would give them the heads up, like, if I have to call you, can I do that? Can we talk about any concerns that I have? I'd want them to know that I might have to call. I would, if I was going to buy a brace again, I would order extra straps right from the start so that it didn't delay and make it so he had days where he wasn't wearing it. And then if I was going to consider a brace, maybe I would choose OrthoPets or Hero braces. OrthoPets is a custom fitted brace. That means that they do a little plaster cast, and so is My Pet's Brace. They do a plaster cast of your dog's leg. And so when this brace goes on, it is form fitted to your dog's leg. And then that's why it doesn't slip around and twist around when they wear it. It's a plaster cast, made from a plaster cast. So OrthoPets is a good one, really good quality. And custom fitted. The next one is Hero Braces. And Ben, I love this guy. He has been accessible to me to ask questions of him. He's just a really good guy, and I like that. I trust him. And if you go on his website, you'll see that when he was young, I think when he was 16, he had osteosarcoma, and he has a prosthetic leg. He's a certified prosthetist. And so I feel like if anybody understands these fitted braces, stifle braces, man, he does. So goherogo.com, I think that's his website. He's got a really good quality brace. I'm going to go back to the chat. Oh, tightrope swivel lock. Oh, it must just be a type of tightrope. Okay. So tightrope surgery is like lateral suture. And it's one of the procedures where we have to be super careful with recovery. Sherry, I don't know if you're here in the live chat, but the tightrope procedure is, because it doesn't use a metal implant or screws, it's just nylon suture material. And so this stuff can snap, it can stretch, and if those things happen, then it means a trip back to the surgeon for repair. And sometimes, like, let's say the dog, if the dog had an accident, like they jumped on the bed and then they became lame, and then the surgeon goes in there and says, okay, well, we know why this implant failed, and we can just do a new implant and just be more careful and controlling the dog's activity after, then they'll do that. But sometimes what happens is with these the more fragile repairs is that then the doctor might say, let's do TPLO, or one of the stronger repairs. So you have to make sure that if you do tightrope or lateral suture, that you be really, really careful and really slow going with the recovery, because the last thing you want is to then have to do multiple surgeries. That's the last thing any of us wants. But you don't want to have to. If you decided that you wanted to do a less invasive procedure like tightrope or lateral suture, you don't want to have to move to TPLO. So just make sure you go super slowly. Keep all the movements controlled. And this is where I feel like getting your house set up correctly is super imperative, so that you can avoid any post-op mistakes, mishaps. A lot of times it's our fault. It snowed today. It's cold right now. Yuck. Boo. I know in Rochester, where I'm from, it snowed. And yeah, it's cold in Canada. It's Canada's fault that where I'm from in Rochester, it's snowing all the time. So we blame Canada all the time for our freezing cold weather. I'm in the suburbs outside of Philadelphia now, so it's kind of cloudy, but maybe I think it's going to hit 60 tomorrow, so we're happy about that. The doggies are super happy. Melinda asks, so what can I do to protect the other knee for 4 weeks? Oh, that's tough. It's tough. And it's going to be all about controlling your dog's movement for 4 weeks, meaning all the stuff that we talked about before, like not letting your dog run, jump, do zoomies. It means setting up your house maybe in a way that he can't run from room to room. If you go outside, make sure that you have a leash and that you're going slowly. Anything you can do just to keep him moving slowly is going to help the injured knee, but then it's also going to preserve the opposite CCL. And we can't guarantee that it's going to be 100% in its ability, in your ability to preserve the other CCL, because the likelihood is that it's going to tear. The odds are bad, but just is what it is. All right, so I don't see any other questions. I'm going to just breeze through my list here. Let's talk about board certification. Okay, so question. if you were going to have, I'll use kind of a similar idea. If you were going to have a knee replacement surgery, would you go to your primary care physician to have that done? They're a doctor. They've been trained. They can do some surgical stuff. Would you go? No, you wouldn't go. You'd go to an orthopedic surgeon. And that's what we should do, in my opinion, when we have a dog that needs a CCL surgery. You go to the doctor who has had years and years and years and years of extra training, and they passed a rigorous exam to achieve that board certification status. Now, I know I'm going to get some flack for this. When we're talking about things like lateral suture or tightrope, a lot of family vets do this. Do I think it's okay? Yeah. I even did a consult for lateral suture with a family vet who did my friend's dog's knee, and her dog did great. And so I consulted with her, and I didn't end up choosing her, but I think that they're capable. But when we're talking about bone cutting procedures, that's the osteotomy procedures, anything where there's a metal implant, I am not for family vets doing this. Now, something you might not know is that a family vet can go, we're going to talk about this as a business thing, okay? A money maker. A family vet can either keep patients, keep clients in-house by learning how to do these things, him or herself. I'm talking about TPLO, instead of referring. We know how much these surgeries cost. Let's say $3,000 to $5,000, okay? Every time a family vet refers you out to an orthopedist, they're losing so much money a year. So what happens? Companies say, we're going to teach you how to do this during a weekend course. And it happens. And if you just do a Google search, TPLO workshop 2020, you're going to find that these family doctors can learn how to, or generalists, or whatever you want to call them, family vets, primary care vets, they can go and in a weekend learn how to do TPLO and then practice on your dog. And I'm not comfortable with it. And so when you see me rant on any of these CCL groups, will always be, and I don't care what anyone says, go with a board certified doctor. I wish I don't see her name in here. I'm going to talk about TPLO. There's an artery in the back of the leg called the Popliteal Artery. One of my group members, she went to a doctor in Philadelphia. The guy told her, I can do these TPLOs with my eyes closed. Well, no, he can't, because he didn't pack off and protect the popliteal artery. He nicked it. That's Vincent. He nicked the artery and closed the dog up, and the dog was bleeding. And she told me my dog's leg is hard as a rock. Well, it's a matter of time before you start seeing the external manifestations of this. The blood started oozing out of the dog's leg. Fortunately, she got the dog to a board certified surgeon who fixed everything up. The dog needed to have another surgery to tie off the artery. Her dog's lucky to be alive. And so this is why I say, don't be swayed by a low ticket price, because you might just end up having to have a surgical revision, and you might end up with complications that end up costing you quadruple what you would have paid if you just went with the more highly trained, highly skilled doctor from the start. If your dog has an underlying medical condition, that is another major reason to go with a board certified surgeon. All right, enough. Hi, Amanda. Good to see you here. Okay, I've just had the Banfield vet. Looks like I'm a little bit behind here. Read the x-ray, and the radiologist read the x-ray and told that Kimchi has joint fusion and possible cranial drawer. They told me that these signs are indicative of CCL or partial or complete tear. Okay, good question. Do you need an MRI? No, you don't need an MRI. So on X-ray, you can see bones and you can see the space where cartilage is, but you can't actually visualize the cartilage because it's not calcific. And you can see muscles as shadows, so they're gray looking. You can see swelling because it's another a different shade of grayness, so you can see the swelling on the X-ray. And a possible cranial drawer, you know, possible. Sometimes it's hard when these dogs are getting their examination because they're resisting the movement. They're pulling, and so sometimes doctors want to do an exam while the dog is sedated. And this lets them really check the laxity. And again, I'm going to show you, they're mobilizing the joint to see how much play is happening there. Because if the tibia can really shift far forward, it means the anterior cruciate or cranial cruciate ligament is not able to do its job because it's torn, either partially or fully. So if we had MRI, could we see the tear? Yeah, but there are so many other ways to tell that the CCL is torn. They'll see signs on the X-ray. There's a thing you can Google search. It's called medial buttress. So when the dog is standing in front of the doctor can wrap their hands around the dog's leg, the inner thigh, and run their hand down and palpate or feel for what's called a medial buttress. And that's kind of just on the inside. Medial means toward the midline or toward the middle. They'll be able to palpate some scar tissue. And scar tissue takes time to form. So if a dog has medial buttress, then that means they've had a CCL tear for a long enough time that they've started to form scar tissue on the inside of their knee. Sometimes we can tell a dog has a CCL tear also by the way they sit with their leg winged out to the side. When we think about lameness, hind end lameness, the top reason for that is CCL tears. So it's like there are a lot of symptoms and signs that go along with making the diagnosis that you don't have to pay for MRI to do it, to get a 100% diagnosis. Oh, Linda's here. Hi, Linda. I was just thinking of you the other day. I hope you guys are doing well. All right, I'm going back to my list, guys. Swelling, if your dog has not had surgery yet, and even if they have, like if they just came home, what I recommend that you do is go online and Google search for pictures of post-op CCL legs so that you know how much bruising it should be there, how much swelling should be there. It's always amazing to me when people post on Facebook and they say, my dog's leg is swollen. And I'm like, oh yeah, of course your dog's leg is swollen. They got their bone cut in half. They got their tibia cut down the front if they had MMP or TTA. Of course there's going to be swelling. Of course there's going to be bruising. The tissue was damaged. So I highly suggest that you know what that looks like so that when you see it, you kind of have an idea, okay, this looks normal to me. Now, one thing about swelling is that when swelling happens, it's just like water, right? Water sinks to the lowest level. Where is the lowest level in our dog? Their paw. So why then, when the incision, I need a dog knee. If my dog wasn't such a lunatic, he could be here, but he's not easy. So we'll pretend this is the front of your dog's leg, okay? So if they're swollen, let's say they were cut here. Why is it swollen all the way down here? It's because all that edema is sinking to the lowest level. So what you can do is massage their leg. You have to be very careful when you're around the incision, because if you've ever had an incision, man, they hurt. And anytime you disturb that incision by scraping against it or stretching the skin, it hurts. So stay away from it. And you can do gentle massage distally to proximally. That means from the bottom toward the heart. And it's just little gentle strokes toward the dog's body from the paw. Okay. I do have a video of that in my group. If you just go to the search and type in massage, you'll see a picture of me in my pajamas doing Vinny's massage. I'm not on camera because it would be scary. It would be like a horror movie. All right. Slippery floors. So Chris, this would be for you or anyone whose dog has not had surgery yet. Actually, anyone's dog who even did have surgery, we've got to control the floor situation, because if the dog slips, then they could have a post-op injury. And then if they slip pre-op, then they just get worse and possibly tear the opposite side. So we want to lay down unrolled yoga mats. You can get cheap ones if you're in the States from Five Below. Well, maybe you can't because nothing's open. I don't know. Maybe online. You can put down non-skid carpet remnants. You can get a carpet runner, non-skid ones. You want to create like little runways around your house for your dog to walk so they're not slipping and sliding on tile or wood floors. Weight loss. Heavy dogs have joint problems. Heavy dogs have arthritis. But do I think, when people are like, my dog lost 6 pounds and they're pre-op, this is tough because the majority of the weight they're going to lose isn't because they're active, because they can't be active if they're hurt. So it means controlling the amount of food that we're giving them, like table scraps and treats. Do I feel like we need to put them on some kind of junky diet kibble or some super expensive like Hills? I won't even go off on that tangent. Do we need to put them on some kind of prescription diet food? No, just relax. Like your dog got a little chunky. We're all getting a little chunky. I'm getting a little chunky here during this quarantine. It's okay. As your dog gets more active, when they start feeling better, they will lose the weight that they gained. Just chill. It's all good. Pee pads. Here comes another rant. If your dog is coming home from surgery, you have to be able to get them up. You have to. So people will say, well, just buy pee pads. Let your dog go on the pee pad. I think it's cruel, because we've taught our dogs forever, don't pee in the house. And you know what happens? You know what it feels like? You do. You know what it feels like when you have to pee, but you have to hold it. It hurts. Your bladder is like screaming. And so this is what happens to our dogs. They're suffering and they have to pee and they finally give up and pee on the pee pad. But gee whiz, like, take them outside. You have to be ready for it. And so you have to have your harness. This is another segue. I didn't plan it. It's just working out like that. I got the Help 'em Up harness. I like that one. There are two that I really love. Help 'em Up is good for the giant breed dogs. And I also like it for the male dogs because the harness itself doesn't get in the way of pressing on their junk and it doesn't get pee all over it. So Help 'em Up is one that I like because it's super sturdy, but it's also got lots of straps. What do people do? They keep their dog in the Help 'em Up 24/7. I don't like it because I feel like it would be like TMI. This would be like sleeping in your bra and all day, every day, and never taking it off. Like, it doesn't feel good. It would feel like it's chafing. Plus, the incision can get rubbed against and stuff like that. So what I did is I put the harness on and took it off. I would kind of like squat down and I would get the harness on his front, and then I would put the little straps around his hind legs. I would just kind of like have him sit as I squatted down. He would sit on my thigh a little bit. It is a pain, man, especially when your dog wants to go out at 2 a.m., which is what he wanted to do. So let me just show you, and I'll tell you the other harness in a second that I like. Okay, I might have to move back. Here, Help 'em Up, okay? This is the front, yeah. Front part, back part. You know what is you guys have to know this. Think about it. If your dog had CCL surgery and then somebody says, well, I got a harness, but they're only showing me this part, the part that goes around their chest. This is not going to do any good. Not enough. If the dog had surgery on the hind end, you have to have something that lifts the hind end. You need this piece, not just this piece. So that's why I like Help 'em Up, because it has both pieces and you don't always have to use both pieces. But certainly during recovery, it's this piece that's going to be the most, what's the word I want? You need this one the most. Necessary, I should say. Now I'm going to unhook it. This is kind of one thing that I didn't like about this harness. So these little straps do have like a little neoprene cover to them. I don't know if it's going to show. It's really thin. And so these end up scraping the inside of their thigh and making it red, especially if your dog wears it all the time. So make sure that if you have a Help 'em Up harness, when you're lifting your dog, I would rather that you don't lift them from the handle, but that you kind of like, let's see, scoop them under their butt, get them standing, and then grab onto the harness. Because if you're just using the harness and you're pulling them up, if this little piece is scraping against the incision, you're basically going like that, scraping it up the incision. Scoop them with your hands, then grab onto the harness itself. I made this little, I'm no seamstress, but I made this little, why do I do that? I made this little sleeve out of this woolly stuff that you can get from like Joann fabric or whatever. And I just slid this over this is hard. This is hard. Over this strap. And then it protected his leg a little bit better. I also, because I was taking this stupid thing on and off, put numbers on them, because when it was 2 o'clock in the morning, I was like, I couldn't think straight. So that helped me. The other harness that I love is Ginger Lead. I love it because, and I have mine at work, shoot, but I love that harness because it's so easy to use. It's not all strappy and crazy like this Help 'em Up, but it's nice and thick, it's plush. And when we look at some of the cheaper ones that you can get on Amazon, what happens is they might start out looking thick, but then when you start applying an upward pressure, what is a thick band kind of scrunches it like accordion pleats down, and now you're pulling your dog up by this really pinchy kind of thin and narrow band. The Ginger Lead does not do that. It's nice and sturdy, but it's super soft too. It has a little leash, and you can see on my YouTube channel, I do a video for why I like Ginger Lead. I didn't do one for Help 'em Up. I don't know. Here's another new product I'll show you. Lick Sleeve is made by a board certified veterinary orthopedic surgeon who realizes that 75% of people, when they get home, they feel sorry for their dog and they take the cone collar off. And then what does that mean? The dog licks the incision and then down the line is prone to infection. So here we have Lick Sleeve, which is a legging. See that? The little picture there of the dog wearing the legging. And that, what I like about this is that it's got a nice wide band that goes around the dog's belly that is then held on by a clasp. So you can make a homemade legging from toddler PJs, but they have kind of like the waistband can be kind of cinchy and put a lot of pressure on your dog's tummy, and I don't like that. When I saw this Lick Sleeve, I love the fact that it has that nice wide band. It looks like it's not going to slip. It's super soft, and what's really good about it is it can be worn on the right or left leg. And so why is that important? Because if our dogs, if the chances are that they're going to tear the opposite CCL, we might as well have one sleeve or one legging that we can use on both legs. You just turn it inside out. So it's really good, a really good product. I'll do a YouTube video about that coming up. I actually did a YouTube video, but I didn't realize, because I was using my phone, that I was holding it up out of the package and the other half of the sleeve was hanging down out of the camera's view. Very smart. So I need to do a redo on that. The incision, what's normal and what's not. I have a YouTube video about all the things that can go wrong with an incision. Know that the very top of the incision usually is the last part to heal. A lot of times I see pictures of the top of the incision and people are like, what's up with this? Why is it still red when all the rest is looking good? There's lots of tension there. And sometimes it's the top of the incision that kind of like just is the last part to heal. You always want to take good, clear pictures of your dog's incision. I'd do it daily just to have a timeline of how it's looking so you can compare. If anything does happen, if you see a little pustule or you see some drainage or something, you know what it looked like a couple days ago. Now, if you're going to send a picture to your dog's surgeon, you want it to be really clear. Otherwise, you're going to have to go in. Now, we've got to be really aware of that with the quarantine, right? So we want to send good quality video footage and good quality clear pictures. How do you get that? You tap the screen. You know, you aim the camera to the dog's incision, and then you tap the center of the screen until it's nice and clear. If it doesn't look clear, you have to back it up away from the incision, and you'll get a really good clear picture that the doctor can actually do something with. Infection. So this is a major issue, a major concern for us through recovery. I know I'm going over an hour, but I'm going to just keep going here. Infection can happen not just as this incision is healing. You can see stuff happening months down the line. And so if your dog is licking the incision, you need to figure out how to keep them away from it. And that might mean that you're not having them wear the cone collar as much. Maybe that means you have to get something like the lick sleeve so they're not able to get to their incision. It's crucial, you guys. These infections can become so problematic that then they have to have plate removal. And it just means another painful surgery and another recovery for your dog and for you. Anyone use CBD instead of the doctor prescribed pain meds that could potentially be damaging to organs long term? Yeah, you've done your research, which I give you props for, because I can tell you're really looking into things, and that's good. You know, I don't know if you've ever had a surgery. I have, a major surgery. And if somebody said, Carla, I'm going to give you CBD. Now remember, with thinking about me as a chiropractor who wants to do things the natural way. If I'm going to have a big surgery, I want medication, legit medication. Now, if my dog is older, then I can understand not wanting to use meds, but I don't know, CBD, it's so iffy. The potency is, I don't know, there's so many unanswered questions about it. I don't know if I'd trust it, quite honestly. This is a major surgery, and I feel like it really requires pharmaceutical medication to control the pain. You do not want your dog coming home after such a surgery and then hoping that CBD is going to work. Can you use it in conjunction? Yeah, I think you can. If you guys go to the Facebook group called Canine Arthritis Management, there is a wonderful vet there, and she mans that group. She does not man the group, but she heads up the group, and her name is Dr. Holly Capon. And she brings on all kinds of people to do interviews with. And I know there is a guy that she brought on, I can't remember his name, but they talk all about the pharmacology and the science of why CBD works, which ones work, which ones don't. They don't talk about brand so much, but they do talk about how this stuff works. So can you use CBD? Yes, I think in conjunction with the pharmaceutical meds prescribed by your dog's surgeon. Pre-op, yes, pre-op, sure. Pre-op, you can definitely use CBD. Does it work? That's what we have to figure out, you know, and you can tell by your dog's symptoms. You have to take some really good notes, Chris, that you can say, okay, well, or get some good video of before you're using the CBD and then after, and see, do you notice a difference? That might help. Not enough data to know for sure CBD will control pain. I'm very holistic, but meds are best, yeah, early on and post-op. I agree. Yep. Bandage adhesive. Some dogs come home with a bandage on their leg, and there was somebody in one of the Facebook groups who said that she puts acetone, which is nail polish remover, on to get rid of the bandage adhesive. Another person suggested, well, I worked for a vet and he has people use engine starter fluid. Can you believe it? Engine starter fluid, because it has some kind of ingredient. What is it? I can't even remember. That's like so toxic. Why use something toxic when you can use coconut oil or olive oil? That stuff is amazing. If you have something that has like a sticky adhesive and you rub olive oil on it, it like disappears. I'm not just saying that because I'm Italian, but like coconut oil works too. It works great. Yeah, it's slow. But if you get a little Q-tip and you dab it and you just slowly work and then peel back the bandage and just keep working on it, you'll get the bandage off and it'll be non-toxic, okay? Okay. Medication issues are a big question for people. People have a hard time giving the medication. The dog can smell it, they can taste it. Yeah, you can hide it in certain foods. In my group, I have a picture, I think it's in the files section, maybe I'll repost it, of all the foods that you can hide pills in. Some people will say, why are you wasting your time with that? Like, just pill the dog, you know, put it in and hold their mouth closed a little bit and rub their throat. Yeah, well, some dogs are okay with that and some are not. I hid my dog's my dog's pills in food, and he didn't care. He did great with that. Be careful with peanut butter, guys, because some people are like putting peanut butter on licky mats and inside Kongs and then putting it on around their pills, and the dog is eating a ton of peanut butter and they can get pancreatitis, which is serious. So too much fat. You don't want to go crazy on peanut butter, and also make sure that in the ingredients there's one thing, and that is peanuts. They don't need salt. They do not need xylitol, which is poisonous to dogs. So make sure no salt, no xylitol, just peanuts. Cone collars. The inflatable cone collar is one that people have some screw ups with, and that's because they don't thread a regular collar through the loops on the inside of the neckline. Those loops are there for a reason. And here's the mistake people make. They don't put the collar through it. And so the dog is pawing away, the collar comes off, they lick their leg. So you have to have an additional collar. Do not use the collar. I forgot to bring mine up. I wanted to show you the difference in length between the collar that you use for the inflatable and the one that you use to take your dog outside. You have to lengthen the one that you're going to thread through the inflatable. Otherwise, it'll be like choking your dog. So let's say you lengthen your dog's collar and then you go to take them outside using the same collar. If you're not going to use the inflatable, if you unthread it and you're just going to take them for a little walk, now that collar's too big, one pull and they're out. And guess what? They can run. They can run even though they're just post-op. So be super careful. If you're going to use an inflatable, get an old collar or buy another cheaper one, and make sure it's long enough so that they're not choking. If your dog is having issues with nausea from the antibiotic, usually it's the antibiotic, you can talk to the surgeon about the possibility of using Prilosec. Don't go online and do your own research on this. And you want the doctor to give you the dosage that's appropriate for your dog's weight. Okay. So, boredom after surgery, there's a website. I'm going to link it in the comments after this is over. But you have to keep your dog kind of, happy. And it's hard to do because they're so bored and they're just crying and whimpering and stuff because they don't know what to do with themselves. But you can change up their scenery. You can let them out on the deck if you have a nice little area where they're not going to be baking in the sun. They should be on a leash. If their leg is exposed and they're not lying on the surgical leg, which is okay if they do. But if the exposed side, if the up side is the surgical side, then you want to put a little towel or a little sheet or a pillowcase or something to protect it from dirt, insects, and direct sunlight exposure because they can get sunburned. Okay. But yeah, you want to switch it up a little bit for them, like put them in front of a different window, move their dog bed. I like the recovery areas better than I like a strict crate rest. Although I understand that if a dog is in a crate, they can't have mishaps, right? But they can have misery. They can be so bored, and that's going to make you miserable. So I like a small recovery area. You have got to know your dog. So like if you've got a big dog that barrels through stuff, that jumps over things, don't use a flimsy plastic exercise pen around your dog because they're going to bust through it. You've got to consider your dog's activity level and stuff like that when you're trying to choose how to contain them post-op. If your dog is not crate trained, now is not going to be the time maybe to stick them in a crate. I've seen so many pictures of busted down crates and they get hurt coming out of them. The last thing they should be doing is digging and breaking out of crates. So that's why preparation is key. And I really think preparation is the thing that's going to make you feel better about your dog's surgery. And it's also going to get you ready for some of the stuff that you're going to encounter post-op. If you practice now beforehand and you get your dog used to some of the stuff, when it's time for post-op, they know their recovery area, they like it, they're used to going outside with the leash on, they've got the new program kind of down, it's going to be so much easier for you. Does anybody have any other questions? I know we're going over an hour here. I do see another question here from Laurie. Is leg shaking a sign of pain? Yes, it can be, but leg shaking can also be weakness. So if the dog is exerting, meaning they're standing up and walking and you notice their leg is shaking, it just could be because they're weak. But if the dog is just kind of lying there in the house and not exerting and they're shaky and trembly, that can be a sign of pain. So that might be something to get a video of and show the surgeon so that they can kind of just guide you on that. And then maybe I would also think of, all right, well, when did I give the pain medication? Is it time for the next dosage? Is that when I'm noticing the shaking coming on? Because if that's the case, then maybe it is pain. All right, that would be a question to have to present to the doctor. Let me just take one. I know I said I was going to quit. Oh, goodness. Let me just make sure there's nothing else I want to. I think you should get 2 cone collars if you haven't had surgery yet. 2 cone collars in case one doesn't work. 2 cone collars in case the dog is able to get the inflatable off, even though they're wearing an additional collar underneath. You want to have something that's on the ready just in case your dog hates the other cone collar. Don't throw out that plastic lampshade one that the vet gave you. Don't do it, because if you only have one other option for the e-collar and your dog gets out of it, you need something so that they can't lick that incision. Hi, Aunt Carol. Good to see you here. Sedation. I'll just do a couple more, okay? Sedation is important for a lot of reasons, and I would say, you know, I used trazodone with my dog, and I'm glad I had it because at nighttime he would get so fidgety, and I think it just really helped him to just settle down and be able to sleep. We want them to be able to sleep, not just so we could finally get some shut eye, but that's so that when we're sleeping, that's when the best healing happens. So we want them to have good restorative sleep, and sometimes the sedative helps them do that. Now, if you're anti-medication, if you worry about you know, giving too many different medications, you kind of have to get over that because your dog's going to come home with lots of meds. Just I recommend at least doing pain meds for a couple weeks. Some people only do 1 week. Some people do even longer, but I think you're going to see that after 2 weeks, your dog's really getting around pretty well, and you might be able to wean them off. Make sure you talk to the doctor about that so that you get help from a professional who understands pharmacology and how long these meds are staying in the dog system before you go and act like a pharmacist yourself. We don't know what the heck we're doing. Let the pros help. All right. One more. I'm just going to do one more. Which one is it going to be? We talked about a lot. Oh, I know. We're going to talk about arthritis. This is the last one. I'm flipping my sheets. Okay. I'm flipping them so that I stop. Does my dog have arthritis? This is the common question. The answer is probably yes. Will they get more arthritis from the surgical procedure? The chances are yes. When we think about medical doctors and orthopedists doing surgeries on knees, a human knee, one of the things they used to do is when people tear their ACL, and it's such a common injury, surgeon would go in there, they'd scope around, they'd go, yeah, you have a torn CCL. You can either have surgery, we can clean it up, we can leave it alone, you can do PT. Well, they found out that just the scoping of the knee was giving people secondary osteoarthritis, a reactive type of arthritis down the road. So can we assume it's happening with our dogs? Yeah. If you have improper biomechanics, meaning the joint isn't moving as well as it should, it's not moving correctly, that's one reason why we develop osteoarthritis, and that's why our dogs do too. So unless your dog had an acute injury that tore their CCL, like they fell off something or they jumped for something and yelped, and not even all those that can actually be an old CCL tear that was partial becoming a full one. But let's say the dog fell and they never limped a day in their life before, they never showed signs of lameness. An acute injury, they probably don't have arthritis, but might they down the line after surgery? Yes. So this is why massage is good. A heated dog mat is good. A heated dog mat is not good if your dog's coming home with a fentanyl patch. You guys do not let your dog get hot with a heated mat, a heating pad, any of that stuff, because the fentanyl, the drug, can all come out. It's time released, like it's not supposed to be all coming out of the patch at once. So don't let your dog get hot with a fentanyl patch. But you know, the same way that we feel better, that humans feel better that have arthritis, so do our dogs. Massage, a warm environment, not sleeping on a drafty floor, not sleeping on a hard floor, you know, like a nice comfy dog bed or something like that is really good for our arthritic dogs. And also a little bit of movement. Remember back when I talked in the beginning, how much movement is too much and how much is just enough? It's like that Goldilocks thing when we're talking about arthritis. We want to figure out, how long can I exercise my dog so that they're not limping after? That becomes the new time threshold that we stay under for our durations. If they're limping at mile 1, we don't want to take them for a 1.5 mile walk every day. You might want to do a half a mile 2 times a day so that they don't limp after. That's how you work effectively with arthritis. You have to honor it. You have to respect it. And you have to work so that you're not letting your dog get symptomatic and then having days of lameness after. Then you're going like a roller coaster. We want to stay nice and level, okay? You guys, thank you so much. I'm so happy that you joined my group, that you came in, that you stuck with me here. I hope this information was valuable to you. If you haven't already subscribed to my YouTube channel, that's going to help it grow. And when people type in TPLO, recovery, or whatever, by the fact that by you subscribing, that actually makes YouTube then say, hey, here's a channel you might like. So if you haven't subscribed yet, I would love if you would do so. And then let's do this again. If you have any ideas, any topics that you want me to talk about, put them in as a comment, and we will talk more another time. Give your doggies kisses. Good luck. Don't worry. You've got like a whole band of people here that are going to cheer you on. We've got smart people in our group. We've got doctors in our group. We have Megan Ann in our group. She will never say this, but she was she just got awarded Cleveland Clinic Nurse of the Year. She's so smart, so wonderful, the kindest heart ever. So use Megan Ann, ask her questions. We've got canine physiotherapists in our group. I can't wait to talk to them. Maybe one day I will get on the stick and do what other people are doing and learn how to do Zoom so that I can do interviews with amazing people. All right? Chris, I'm so happy you liked it. You're going to do great. Just keep researching. You're doing fine with that. And when you're educated, you can make knowledgeable decisions. Informed decisions are always best. Just be careful that you don't keep reading and reading and reading and then stagnating and doing nothing. That's what I did, and I wasted lots of time. He could have been healing, and what was I doing? Staring at my computer, learning about dog knee anatomy. So a little research is good, but you're going to do fine, okay? Don't be fearful, you guys. You can do it. Totally can do it. Rock the recovery. That's all you've got to do. We're here to help you do it. All right. Thank you so much for watching. We're going to do this again. Have a great day.